am Violet Newborn. I'm the founder of Color Your Story Onto Mine. It's a nonprofit in Memphis, Tennessee, and a certified recovery faith-based initiative. And essentially, we work with survivors, specifically survivors of childhood abuse or childhood ACEs. And we essentially work through trauma-informed empathy and teach nonviolent communication, emotional literacy, and life skills, all through art. I'm passionate because this is personal. I've lived the very challenges I now work to address, fighting for proper diagnosis and support for my son, battling stigma around mental health, and navigating the trauma of both poverty and environmental injustices. My background as a survivor, artist, advocate has shown me how transformative it is when women, especially Black mothers, are empowered to speak, heal, and lead. I got into this field by necessity through my son's diagnosis with lead poisoning. I realized the systems were not built to protect us, so I had to become a protector and advocate for myself and him. That journey birthed my organization, blending creative expression with trauma-informed advocacy to support families like mine. In my work to Color Your Story Onto Mine and co-chair of Alarm, Advocates for Lead Awareness and Remediation in Memphis, I focus on the intersection of maternal health and environmental trauma, particularly lead exposure. Many of the mothers I support, including myself as a mother of a lead-poisoned child, face compounded challenges related to housing insecurity, toxic exposure, and lack of trauma-informed care. Black maternal health is central to my advocacy because I believe healing begins not only with access to care, but also with being seen, heard, and supported in safe places. Personally, with my son, who was diagnosed with autism and being nonverbal, since I was already in the space with using art, I was able to use my curriculum with him. And now he's 6 years old. He speaks. He's on a third grade reading level, but he's in kindergarten. He was able to articulate himself, thereby skipping the phase of biting or being aggressive or frustrated because he could not be understood. So he was able to write and draw and express himself in ways through play before he was able to verbally do it. So now that he's able to verbally speak, we still continue on drawing and painting and having him write, and through play, with him being so young, water play, it's all kind of creative things and outlets that you can do past being diagnosed. And I've incorporated those resources within my nonprofit to make available to other children who are impacted by lead poisoning, because it can be frustrating. And there's ties where I work in the prison system, so I see this correlation between, those affected by certain traumas, including lead poisoning, things like that. And then, 10, 20 years later, like, they're ending up in prison. So I'm hoping to break a cycle and be proactive and give everyone a voice, because at the end of the day, we all want to be seen, heard, and understood. I've always been an individual where if I see a closed door, it was a reminder that I am a door. So if you see a closed door, you keep running to closed doors, it's probably because you are a door. And so I've just incorporated it into my nonprofit and add value to its uniqueness. And I have people reaching out to me now because once you get a diagnosis for your child from having a developmental delay, especially due to lead poisoning, a lot of times that's it. You just have a child who's labeled autistic or slower or whatever else, and there's no other resources. But I'm a door. Environmental justice is deeply tied to Black maternal health because Black communities are more likely to live in areas with environmental hazards, old housing with lead paint, poor air quality and water quality, and limited access to green spaces. These exposures directly affect pregnant women and children, increasing risks like preterm birth, low birth weight, and developmental delays. In Memphis, I've seen how systematic neglect of Black neighborhood leads to toxic stress and toxic environments. A double burden for Black mothers. Environmental justice is about ensuring safe, healthy conditions for mothers who thrive before, during, and after childbirth, and it must be part of any conversation about maternal equity. I'll say my biggest concern is that Black maternal health will continue to be treated as an isolated issue rather than a reflection of broader systematic injustice, from environmental racism to mental health disparities to economic inequality. Equity. Sorry. If we don't address root causes, we'll keep treating symptoms while Black mothers and babies continue to suffer. I'm also concerned that funding and attention may shift away from the community-based solutions, when in reality, the answers live within the community most impacted. We need sustained support for trauma-informed, culturally rooted care and policies to protect Black lives at all stages. That means listening to Black mothers, funding grassroots initiatives, and pushing for policies that address both healthcare and environmental safety, like universal lead screenings, affordable safe housing, and trauma-informed maternal care. People can also volunteer, donate, or amplify the work of organizations like Color Your Story, YGG, Alarm, who are on the ground every day transforming lived experiences into systems change. Creative outreach, storytelling, and policy reform all need support. That